Health Minister Dr. Phaahla says the COVID-19 pandemic derailed the fight against tuberculosis. Phaahla says this has set South Africa's fight to about 12 years back. We're now joined by Dr. Norbet Ndjeka, Director of Drug-Resistant TB and HIV at the National Department of Health, as well as Bonolo Mathekga, a researcher and scientist who's come up with an innovation to plug the gap. Thank you very much to both our guests for your time this afternoon. Dr. Norbet, perhaps let's start with you and we can set the scene in terms of just how dire the situation in the country is.
Yeah, thank you so much. Thank you for the invitation. I also just wanted to indicate that I got redeployed to a position of Chief Director TB Control after several years as Director for Drug-Resistant TB.
Congratulations.
Okay. Yeah. Thank you so much. Yeah, so the TB situation is a serious one. I mean, we are among the 30 countries in the world with the highest burden of TB. We have approximately 304,000 people developing active tuberculosis each and every year in South Africa. Although that has dropped from 600,000 plus, we're now at 300,000, but still we want to do better. We want to bring it down to 30,000 per year, not 300,000 a year.
Mm-hmm. You want to do better, and Bonolo Mathekga is, I guess, ready and able to assist in making that a reality, because, Bonolo, you've come up with an intervention, a community-based testing toolkit to fight the scourge of TB in our communities. Just introduce that to our viewers.
So hi everyone, my name is Bonolo, and thank you, Dudu, for taking the time to talk with me today. So I came to Johns Hopkins University to get my master's degree, and during that time we also spent some time in South Africa with the Aurum Institute in Tembisa, where we were basically doing door-to-door rounds with the community healthcare workers. And what we realized is that all they have is a piece of paper that basically just asks patients if what symptoms they've been experiencing. So if they've been having night sweats and fever and coughing. However, they don't have an actual way of testing patients on the spot. So we came up with just a portable screening device that we can use to screen patients for tuberculosis. And by doing so, then you can then refer them to the clinic for further testing and for treatment initiation.
Dr. Norbet, hearing that, are we as a country responding with the needs of the times, especially when we speak of innovation, in order to tackle TB?
Yes, as a country, we really responded. We're coming to the party. We became the first country in the world to introduce molecular testing for TB or TB presumptive individuals in South Africa. We started, other countries have followed, precisely because of our political leadership. This test was expensive by then. Now the prices have gone down, but you need to find TB in order to end TB.
Yeah. Okay, Bonolo.
Yeah.
I beg your pardon, Doc. You finished your thought?
Yeah, no, I'm just saying that this intervention by Bonolo is very important to us, because we have a big problem with TB, because over the years we've not been finding enough people with TB. Hence, those who remain untreated pass on TB to the others. So we really welcome any initiative to test even more people with TB.
Bonolo, because TB is a preventable and curable disease, and you further note that, I beg your pardon, South Africa is facing a massive TB epidemic which disproportionately affects low-resourced communities. Limited access to healthcare and slow diagnostics hinder effective disease control and prevention. And so, Midubi, has been your response in trying to curtail the spread of TB and find it before things go beyond a point of fixing them. When you went into these low-resourced communities, what did people tell you and what did you find?
So when we went into the communities, we were in Tembisa and in Klerksdorp and other communities, and basically TB is still very stigmatized in South Africa. And for example, even if people did show symptoms, one of the people we interviewed was like, she would even go so far as going to another clinic in another city to get tested just so that her friends and people in her community don't know that she has TB. So by doing so, then she gets tested in a facility that's so far away from where she lives, which means that her treatment plan and initiation process takes place at a clinic that's so far away from where she lives. And then you have instances where patients are now lost to follow up because they simply can't sustain having to travel such long distances just to get treated. So I think it's very important to be able to test people within the comfort and privacy of their own homes. And then by doing so, we can also reduce issues like stigma, because if you're able to get tested, then you're able to get initiated on treatment. And then I also wanted to point that the Prof mentioned that South Africa is very fortunate because we've been able to purchase a lot of molecular testing. However, this is not necessarily the case in the rest of the world, because according to like the WHO report, 2/3 of the world still get diagnosed using smear microscopy, which is only 50% accurate. So, and because of like what the pandemic has taught us, we can't just look at South Africa in isolation and be like, we are solving our TB problem. We have to globally end the TB pandemic together.
Doc, Bonolo speaks of going into the community, testing people in the comfort of their own homes, because it remains a stigma in this country. Is this an intervention that you're open to?
This is something that we've been wanting to have over the years, and you know that the whole process of getting tests or medicine endorsed to a point where we now start to use is too long, but it's something that we really want. Treating people at the clinic, treating people at the comfort of their homes, it's very important. And we really welcome that, and like to see more innovation around that. But also, why just sputum? Why can't it be a swab in the mouth? So these are the type of things we really want to move TB diagnostics and treatment forward.
Bonolo, why Medupi? Because for us, so the name of our startup company is Drizzle Health, and Medupi was a direct translation of that. But also we envision Medupi or Drizzle as a metaphor for healthcare. So we want everyone to experience healthcare the same way, irrespective of their race, their societal or socioeconomic status. And similar to how when it rains, we all experience it the same way. So that was the reasoning behind the name.
Long may you continue to nourish your communities, especially those low-resourced ones. In closing up the conversation, Dr. Norbet, what is it that you want to tell South Africans, especially when we speak of the issue of stigma?
Yeah, the stigma is not necessary. Any one of us can get tuberculosis. It doesn't make sense to stigmatize people who have TB. We could be having TB. TB has been long. And I'm sure each one of us in our families or at workplace or people we close to has had TB at some point in their lives. So this is something that is really giving us problems. We cannot achieve the kind of treatment success we need. So we really call upon South Africans to abstain, to not to do that, to refrain from stigmatizing, but rather support people with TB. 56% of TB patients in South Africa undergo catastrophic costs. They spend more than at least 20% of their income for TB-related needs, like vitamins, food, and all special food and things like those. So we need to support these people so that we are able to cure them. If we find all people with TB, we treat them well. That's the way we're going to end TB in South Africa.
Bonolo, what is the success rate of that intervention?
So currently we are running an ongoing pilot study in India on discarded patient samples, and so far we've achieved 100% concordance with our comparator test, being the molecular gold standard. So yeah, we're doing really well so far.
Have you found each other with the Department of Health, Bonolo?
No. So right now we were working with the PHRU as well as the Aurum Institute in South Africa, and we're also leveraging our existing partnerships in India. However, we will be finding each other after this call. So thank you very much for the introduction.
Dr. Norbet, there you go. Bonolo, South Africa's very own, trailblazing in India with her and her team's intervention, and perhaps you guys can find each other to bring that closer to home. A big thank you to both our guests for your time this afternoon. Dr. Norbet Ndjeka is the director. Doc, please do, I do beg your pardon, Deputy Director now?
Chief Director,
there we go.
Control and Management.
Chief Director, thank you very much, and congratulations once again on the promotion. Bonolo Mathekga is a scientist as well. Thank you very much, both of you, for your time this afternoon.